Hello everyone, welcome to our channel. It's Income for Tuber. This is the part 2 video of the humerus. My previous video is on part 1 video of the humerus. If you have not watched my previous videos, please kindly check my description. I have dropped a link of every bones, that is scapula, clavicle and part 1 video of the humerus. If you didn't get the links, please kindly check my channels. I have created a separate playlist for upper limb bones. In my today's part 2 video of the humerus, I am going to give the deep explanation about the attachments of ligaments and muscles and nerves with the humerus bone. Attachments of humerus bone. Let us come to the attachment of lesser tubercle, greater tubercle and intertubercle sulcus. I have taught you in my previous video the features of humerus. Here this is lesser tubercle and this is intertubercle sulcus and this is greater tubercle. Okay, let us come to the attachments. Which muscles are inserted in these places? At lesser tubercle, there is insertion of subscapulary. At greater tubercle, there is insertion of supraspinatus, infraspinatus and teres minor. And at intratubercle sulcus, there is insertion of pectoralis major, latissimus dorsi and teres major. Here comes the revision of my previous video of bone scapula. In my previous video, I have taught you that at subscapular fossa, there is a rise of subscapularis muscle. And at supraspinous fossa, there is a rise of supraspinatus, and at infraspinous fossa, there is a rise of infraspinatus. And at the lateral border, lower 1/3, there is a rise of teres major, and upper 2/3 there is a rise of teres major, and at inferior angle there is a rise of latissimus dorsi. Right? These muscle from scapula are inserted into these parts of humerus. Okay. First, lesser tubercle. Lesser tubercle, there is a insertion of, at lesser tubercle, there is a insertion of subscapularis. Subscapularis muscle comes or arise from subscapular fossa of scapula. Okay, from subscapular fossa of scapula, subscapularis arise and get inserted into lesser tubercle of humerus. Now, let us come to the greater tubercle. This is lesser tubercle, this is greater tubercle. Okay, greater tubercle. At greater tubercle, supraspinatus and infraspinatus and teres minor. Supraspinatus from supraspinous fossa, infraspinatus from infraspinous fossa. First, supraspinatus. Supraspinatus from supraspinous fossa of scapula. The muscle get inserted into the uppermost part of greater tubercle. At uppermost part of greater tubercle, there is insertion of supraspinatus muscle from scapula of supraspinous fossa. Next, infraspinatus. From here, infraspinatus arises at infraspinous fossa of scapula, and this infraspinatus muscle get inserted into the middle part of greater tubercle. At upper part, supraspinatus. At middle part, infraspinatus. Supraspinatus, infraspinatus, teres minor. At the lateral border, upper 2/3 part, there is a presence of teres minor, 2 slips of teres minor. In between that, there is a presence of circumflex scapular artery. These 2 slips of teres minor arises at the upper 2/3 part of lateral border of scapula, and this teres minor is get inserted into the lower part of greater tubercle. At the lower part of greater tubercle. First, upper part supraspinatus, middle part infraspinatus, lower part teres minor. From where? From here. Supraspinatus from supraspinous fossa, infraspinatus from infraspinous fossa, teres minor from upper 2/3 lateral border of scapula. Okay, teres minor, supraspinatus, infraspinatus is inserted into greater tubercle, the supraspinatus, infraspinatus and teres minor. Okay, upper part supraspinatus, middle part infraspinatus, lower part teres minor. Lesser tubercle, subscapularis. At greater tubercle, supraspinatus, infraspinatus, teres minor. Let us move to intertubercle sulcus. Between lesser tubercle and greater tubercle, there is a presence of a sulcus that is called intertubercle sulcus. Okay, at intertubercle sulcus, there is a insertion of pectoralis major, latissimus dorsi, teres major. Pectoralis major inserted into the lateral lip of intertubercle sulcus. You know, this is the medial lip and this is the lateral lip. Right? Medial lip, lateral lip. Medial lip comes at the medial end of the greater tubercle. Lateral lip comes at the lateral end of the lesser tubercle. This is medial lip and this is lateral lip. At the medial lip of the intertubercle sulcus, there is insertion of pectoralis major. Next, latissimus dorsi. Latissimus dorsi inserted into the floor of intertubercle sulcus. At the floor of intertubercle sulcus, there is an insertion of latissimus dorsi. This latissimus dorsi comes from inferior angle of scapula. At the inferior angle of scapula, there is a arise of latissimus dorsi. This latissimus dorsi muscle is inserted into the floor of intertubercle sulcus. Next, teres major. Teres major inserted into medial lip of intertubercle sulcus. This is the medial lip of intertubercle sulcus. At this medial lip, there is insertion of teres major. Again, here, the insertion of teres major at a medial lip of intertubercle sulcus is from the lower 1/3 of lateral border of scapula. At the lower 1/3 lateral border of scapula, there is a arise of teres major, and this teres major muscle is inserted into medial lip of intertubercle sulcus. So almost all muscles which are get inserted here are from scapula. And again, this intertubercle sulcus contain again two special parts, that is tendons of long head of biceps brachii and its synovial sheath. This intertubercle sulcus contain again two special parts, that they are tendons of long head of biceps brachii. You know that in scapula at supraglenoid tubercle, this is infraglenoid tubercle, this is supraglenoid tubercle. From here, long head of triceps brachii arises. From here, long head of biceps brachii arises, in which the tendons of long head of biceps brachii is inserted into intertubercle sulcus. And another part, ascending branch of anterior circumflex humeral artery. Remember, important, where does humeral artery is present? Of the ascending branch of anterior circumflex humeral artery present at intertubercle sulcus. Okay. The two special parts are tendons of long head of biceps brachii and its synovial sheath, and another one is ascending branch of anterior circumflex humeral artery. Okay, we have finished the lesser tubercle, greater tubercle, and intertubercle sulcus. And another three muscles are there. They are deltoid, coracobrachialis, and brachialis. Before we continue, if you have not subscribed my channel, please kindly take a minute and subscribe my channel and comment below that you have subscribed my channel. First, deltoid. Let us come to the deltoid. In my previous video, I have taught you that there is a presence of triangle here, in which it is called deltoid tuberosity. In Greek, the deltoid means triangle. Okay, this triangle part called deltoid tuberosity. At this part, there is a insertion of deltoid muscle. Again, the deltoid muscle comes from scapula. In my previous scapula video, I have showed you at the lower crest, there is a arise of, at the lower crest of spine, there is a arise of deltoid muscle. And this deltoid muscle is inserted at deltoid tuberosity of humerus. Okay, next let us come to the coracobrachialis. Coracobrachialis inserted into rough area on middle medial border. Okay, you know, this is medial border. At the middle medial border, there is a insertion of coracobrachialis. And again, this coracobrachialis is inserted from scapula. Look, you know, this is the coracoid process. At the tip of coracoid process, there is a arise of coracobrachialis. This coracobrachialis is inserted into middle part of medial border of humerus bone. Okay, coracobrachialis. Next, let us come to the brachialis. Brachialis arise from lower half of anterior medial surface and anterior lateral surface of the shaft. Here, I will mark. Okay, this much portion, at this much portion is covered by brachialis. Okay, this much portion is completely covered by brachialis. Okay, let us come to the lower end. At lower end, at medial epicondyle and lateral epicondyle. You know, this is the medial epicondyle and this is the lateral epicondyle. Okay, wait. This is medial epicondyle and this is lateral epicondyle. At medial epicondyle, this is anterior aspect and this is posterior aspect. Okay, at medial epicondyle, there is a arise of superficial flexor muscle of forearm arise from common origin from anterior aspect of medial epicondyle, and this is called common flexor origin. Okay, remember, at medial epicondyle, there is arise of superficial flexor muscle of forearm arise from common origin from anterior aspect of medial epicondyle called common flexor origin. Okay. Next, let us come to the lateral epicondyle. This is lateral epicondyle, this is the anterior aspect and this is the posterior aspect. Okay. The superficial extensor muscle of forearm and supinator have a common origin from lateral epicondyle called common extensor origin. Here, this is called common extensor origin. Superficial extensor muscle arises. Okay. Next, the onconius, in Greek it is known as elbow. Onconius is known as elbow. The onconius arise from posterior. Onconius arise from posterior surface of lateral epicondyle. I have said that this is the anterior aspect and this is the posterior aspect. From the posterior aspect, there is arise of onconius in lateral epicondyle. Here, superficial extensor muscle in which this origin is known as common extensor origin. At posterior aspect, there is arise of onconius muscle. Here, common flexor origin. Here, common extensor origin. Common flexor origin, common extensor origin. Here, superficial flexor muscle. Here, superficial extensor muscle, and here, onconius muscle. Next, lateral supracondylar ridge and medial supracondylar ridge. This is medial supracondylar ridge. This is lateral supracondylar ridge. At lateral supracondylar ridge, upper two-third, there is a presence of brachioradialis, and lower one-third, there is a presence of extensor carpi radialis longus. Brachioradialis, extensor carpi radialis longus. Okay, let us come to the medial supracondylar ridge. At medial supracondylar ridge, lower one-third, there is a presence of pronator teres, in which this is also known as humeral head. Okay, humeral head. The pronator teres is also known as humeral head. So we have finished lower end. Let us come to the surfaces. Let us come to the surfaces. At posterior surface, above the radial groove, you know that there is a cross of radial groove at the posterior surface. Okay, the above the radial groove of posterior surface, there is a presence of oblique ridge. There is a presence of oblique ridge. Okay, on upper part of triceps brachii arises. Okay, on upper part triceps brachii arises. There is a presence of oblique ridge, and on upper part there is a presence of triceps brachii. Next, posterior surface below the here radial groove, above the radial groove, biceps brachii arises. Let us come to below the radial groove of posterior surface. It is a medial head arises. The medial head arises. Here medial head arises and upper part triceps brachii arises. Next, let us come to the ligaments, that is the capsular ligament. There are two part I have divided into two parts, that is ligaments of shoulder joint and ligaments of elbow joint. Okay, let us come to the ligaments of shoulder joint. Capsular ligament of shoulder joint attached anatomically neck except on medial side. Okay, this is medial side, except on medial side where the line of attachment dips downward. The line of attachment dips downward. There is a presence of capsular ligament of shoulder joint in which 2 centimeters to include a small area within the shaft. Within the shaft, it includes 2 centimeters of small area. The lining is interrupted at intertubercle sulcus to provide aperture. Okay, this is intertubercle sulcus. The line is interrupted at intertubercle sulcus to provide aperture when tendon of long head of biceps brachii leaves a joint cavity. At this part, the long head of biceps brachii leaves a joint cavity. Okay, let us come to the elbow joint. The capsular ligament of elbow joint attached to the lower end along a line that reaches the upper limits of radial and coracoid fossa. Radial and coracoid fossa anteriorly and olecranon fossa posteriorly, in which the fossae lie within the joint cavity. Clear? On lateral side, it passes through between the lateral epicondyle of capitulum. On lateral side, it passes through lateral epicondyle of capitulum. This is capitulum. Okay, here in between it passes. Okay, so capsular ligament we have finished. Now there is three important nerves, and in which these three nerves are directly related to humerus. The three nerves are axillary nerve, radial nerve, and ulnar nerve. Axillary nerve present at surgical neck. Okay, axillary nerve present at surgical neck. Axillary nerve present at surgical neck. Next, radial nerve. Radial nerve at radial groove. You know that from here there is the radial groove will across around like this. At this part there is a presence of radial nerve. Ulnar nerve behind medial epicondyle. This is medial epicondyle. Behind medial epicondyle there is a presence of ulnar nerve. These nerves are liable to injure, and since surgeon should be careful during his surgery. Okay, he should be aware of these three nerves while surgery. Okay, we have finished the attachments of humerus. Okay, let us come to the ossification. Humerus ossifies from one primary center and seven secondary center. The primary center appears middle of diaphysis during 8th week. Okay, middle of diaphysis during 8th week primary center appears. Next, the secondary centers. Let us come to the secondary centers. The upper end ossifies from three secondary center. The upper end ossifies from three secondary center. The head ossify at first year and greater tubercle. The head ossifies at first year and greater tubercle ossifies at second year and lesser tubercle ossifies at fifth year. These three fuses during sixth year to form one compound epiphysis which fuses with shaft at 20th year. Epiphyseal line encircles bone at the level of lowest margin of head. This is the growing end of the bone. The nutrient foramen is directed away from the growing end. Next, let us come to the lower part. The lower end ossifies from 4 center, which from 2 epiphyses. Okay, capitulum and lateral phalange of trochlea at first year and medial phalange of trochlea at 9th year. The lateral phalange of trochlea at first year and medial phalange of trochlea at 9th year and lateral epicondyle at 12th year. And lateral epicondyle at 12th year. These three fuses at 14th year to form another compound epiphysis which fuses shaft at 16th year. Next, the center for medial epicondyle appears at 4 to 6 years, forms separate epiphyses and fuses with shaft during 20th year. So ossification is also over. Next, let us come to the clinical anatomy of the humerus bone. The common sites of fracture of humerus are cervical neck, shaft and supracondylar region. First one, supracondylar fracture. Supracondylar fracture is common in young age. It is produced by fall on outstretched hand. The lower fragment is mostly displaced backwards so that the elbow is unduly prominent, as in dislocation of the elbow joint. This fracture may cause injury to the median nerve. It may also lead to the Volkmann's ischemic contracture caused by occlusion of brachial artery. Above in this video, I have showed the two pictures. In that picture A is a supracondylar fracture of humerus and the picture B is Volkmann's ischemic contracture. The next, another one, the three bony points of the normal elbow forms a triangle in the flexed elbow and are in one line in an extended elbow. In the given above picture, you can observe the relationship of the lateral epicondyle, olecranon process and medial epicondyle. The picture A is flexed elbow and the picture B is extended elbow. Next, the humerus has a poor blood supply at the junction of its upper 1/3 and lower 2/3. The fractures at this side show delayed union or non-union. Next and the last one, the head of humerus commonly dislocated inferiorly, that means the subglenoid. The above given picture you can observe the inferior dislocation of humerus. So that's all for today. We have finished the humerus bone. If you want to watch my previous videos on or previous bones, you can check my description or else you can check my channel. I have created a separate playlist for them. I hope these videos are helping you to revise or else to learn from the first. If you feel these videos are helping you, please kindly subscribe my channel and share it to your friends. If you have subscribed my channel, please kindly comment below that you have subscribed my channel or else you can also comment that your queries. I will definitely answer your queries, and also you can comment what type of videos would you like to watch from my channel. I will do it for you. Please do support and be in subscribe. If my subscriptions or my views are not increasing, I'm going to stop this channel. So I'm sorry for that, those who are subscribed, because I need more and more students to utilize this opportunity. If there are no students to utilize this opportunity, obviously I'm going to stop this channel. So if you like to continue in my channel, my next new video, that is the video of the ulnar and the radius, will be uploaded after 2 days. Until that, you study and finish this much portion of the bones. See you on my next video. Subscribe, like, share, comment. Thank you for watching. See you all next. Bye bye.